The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Have you ever thought what the human body would be like without a skeleton? We're going to be talking about some skeletal problems and what you can do for it during this next program. Join us for it.
Welcome to Help Yourself to Health with Dr. Agatha Thrash of Uchee Pines Institute. And now, here's your host, Dr. Thrash.
The skeleton is a framework for the body. Without it, we would simply collapse down into a mass that would be unable to function. The heart would not be able to function. The digestive tract could not function. What would the brain do, which is sort of gelatinous anyway, and if we had it just in the hands, it would just sort of spill over the hands. What could we do without the framework of the human skeleton? For us, the framework of the skeleton is somewhat like law is to the Christian. Law is the framework on which we make our character development, which we express our personality. Our behavior is judged and guided by that. And so for the Christian, law is as important as love. Someone has described it this way: what would you rather have, a glass or grape juice? Well, neither. The glass without the grape juice is not very nice, and the grape juice without the glass is all over the place. Well, the skeleton is somewhat that way. Now, there are some things on the inside of us that also affect the skeleton. Sometimes the way that we breathe can affect the skeleton. To give you an example, the way that we breathe can affect the chest cage. And I'd like to show you representations of lungs, one a normal lung and the other an emphysematous lung, which will help you to understand why this is true. What we're seeing here, two lungs, one a normal and one an emphysematous lung. Notice that this normal lung has some black pigment in it, which you can easily see here, but that's just the normal outcome of our living in this world. But if you will notice closely, the lung tissue itself is comprised of a very finely placed, close together, close-knit, sponge-like structure. There are some bronchi, which you can see here, cut, and here is the lobe fissure. But this is a normal lung. Anyone who has this kind of lung will be very pleased with it. It will serve them very well. But then over here on this side, we see the lung of a smoker, a long-term smoker. First, you can see right off that the black deposits are much more intense than in the normal lung. Here is the lobe fissure, as we saw in the normal lung, but notice these very abnormal vacant spaces here, a very coarse sponge. Now, of course, when such a person has all of these big open spaces to grow as the emphysema develops, then this kind of person is going to need more and more room in the chest. And so the ribs begin to expand as the lungs expand. The lungs can expand all the way down into the abdomen. In fact, many times the first symptom that the doctor hears about is abdominal symptoms because of the growth of the lungs or the pushing down of the lungs with the depression of the diaphragm that occurs with this. And of course, with the barrel chest may come some other symptoms, some neurologic symptoms having to do with the back. Or because of the posture that the person with emphysema has to maintain, there may also be backaches. Pains then can occur most anywhere in the upper part of the body, can occur in the shoulders or in the arms or hands or wrists, and we'll be talking about some other things that will help you to understand some causes of shoulder pain. Now, of course, the moral of the story that we just saw about the emphysematous lung, the thing that we should guard against is ever developing a smoking habit. And if you have one, you should get help so that you will not continue to have this very health-damaging habit. It damages the health in every way. Every organ and every system is damaged by the smoking habit. Now, the next thing that I would like to talk with you about is what we call the thoracic outlet syndrome. And I have asked Cheryl Shears to be with me on the program for this so that we can demonstrate for you the way that you can tell, even in your own home, whether you have the thoracic outlet syndrome. Now, the symptoms of this are that there is pain in the hand or in the arm or forearm, wrist or hand, but mainly it might be in the forearm, wrist, and hand. This syndrome is caused by the neurovascular bundle which comes out from the spine, and you can see here what I'm pointing to. From the spine come several nerve trunks which join together and come between the two muscles, the anterior scalene and the medial scalene, then pass under the collarbone and come into the arm in this way. And all the structures of the arm are supplied by these nerves. Along with that comes the blood vessel, the major blood vessel. The subclavian, named for the clavicle, comes along here and joins the nerves so that it is then called the neuro, for nerve, vascular bundle. And it then supplies the blood and the nerve for the entire arm and for a portion of the shoulder. So if you have pain in the forearm or hand or wrist, then just find the radial pulse, and that is important. Get the radial pulse. It will be easier to do the test and much more accurate. And just think about it for a little bit and study it a bit, and you'll be able to tell just how strong the pulse is. And then by having the patient do several things, you can decide whether it is a problem with the neck or a problem as the neurovascular bundle goes between the first rib and the clavicle, or whether it is a repetitive strain injury, which may be a problem for the scalene muscles, but is also likely to be due to the pectoralis minor muscle, which which collects itself and sends its tendon up and connects to the coracoid process under these structures here. Of course, when the neurovascular bundle passes by that, if we have a problem with the pectoralis minor muscle, then of course you can have a problem that will be referred to the lower part of this upper extremity. So with some very simple tests, find the radial pulse, then instruct the patient to look over the right shoulder up and over in this way. Now you can see that this will squeeze the neck. All the time you are studying the radial pulse. Does that cause a reduction in the radial pulse? Then you have the patient turn and do the opposite side, the same kind of movement. Again, you're studying the radial pulse. And while the patient does this, if you find a reduction in the radial pulse, then you will know that the problem is in the neck and will need to work there. All right, the next one of the tests that the person can do, the next one of the maneuvers that the person can do that will give you a good test, you're still holding on to the radial artery and feeling its character. With this one, you have the person bring the shoulder blades together and up as high as they can, and the chin is depressed on the chest as much as possible. Now that will make the clavicle or the collarbone go down and the first rib go up. You're now studying the radial pulse to see if this maneuver makes the radial pulse less. All right, the next one, the next maneuver, if that is true, then if the radial pulse is reduced on that one, that means that the clavicle and the first rib are squeezing the neurovascular bundle, and the person needs to improve the posture and have a much better posture in order to get a better function. The next one is simply to extend the arm in this direction. Again, your fingers are on the radial pulse, and if there is a problem here, then you will know that the pectoralis minor muscle is the thing that is at fault. And the next one is that, again, with your hand on the radial pulse, you put some traction in this direction, and that will let you know if the person has a cervical rib. And that one is not a lot you can do about that one, but there is that possibility. Muscular exercises and massage, and also the use of some very simple applications on the outside can be of help in that way. So this can help you with making the diagnosis. But now you need to know how to treat it. And because muscles are involved in at least two of these causes, I've asked Danique Blackburn if she will come on and show how to do a massage on the neck so that you can see the kind of technique that can be used both on the neck as well as on the pectoralis minor muscle. So Danique, would you show us?
To begin the treatment for this, you will want to position the patient anyway in a relaxed position for them, and you will want to massage beginning here from right underneath the ear down to the collarbone. And you will want to apply a good amount of pressure here and just begin to massage it in a stroking-like fashion. And also, as you are massaging, you may come across points of excess tension, and at those points you can begin to apply pressure, which is called trigger point therapy. And the way that you do that is you begin to apply pressure to the point of tension and hold it there for 10 seconds and then release.
Okay. Very nice. And of course, the trigger point treatment will sometimes have to be done not only on one point, but all satellite points around that one point. This is caused by a segment of the muscle actually going into a little sort of spasm or a very tight contraction, and then it holds that. It sort of learns to hold that. And so a person can get chronic pain in a muscle just because of these little trigger points. There was a doctor who was the White House physician, Dr. Janet Travell, who worked this out about the trigger point therapy. She was the White House physician in the Kennedy administration when she being a physical medicine person, worked on Jack Kennedy, who had the PT boat accident and the problems that developed after that. And she developed a very nice system of the trigger point therapy. Now, there is another thing that we can do for pain, and the things that we can do for pain are, some of them are to apply liniments or substances on the outside of the body which act as a counter irritant. And Cheryl is going to show you now how to make a very nice little substance, red pepper extract. And as you could imagine, it does feel hot on the skin when it is applied, at least in some people. Others seem to be able to apply it to the skin, and it doesn't seem to cause them a lot of problem. But the thing that happens with the making up of this is that the capsaicin in the red pepper is likely to use up all the pea substance, And P substance is like a neurotransmitter in the skin, which must be a part of the communication system to transmit pain. And here we have the materials for doing the red pepper extract, and so we'll ask Cheryl now to show us how to make this extract.
Okay, I'd be happy to show you how to make the red hot extract, and as you look on your screen you will see the recipe. It's very simple. You only need 2 items, 1 cup of rubbing alcohol and 1 teaspoon of red hot pepper, capsicum. And you just take these 2 ingredients, mix and soak ingredients for 3 weeks in a tightly covered jar. Save the alcohol after that, pour it off the top, discard the pepper, and label external use only, rubbing alcohol extract. Now I will show you. I'll just make it up very quickly. I have some hot pepper here and 1 teaspoon. I'm just going to put it into a pint-sized jar here. Rubbing alcohol, 1 cup. This is something that will save for a long time. Just mix it together. Stir it. Remember to let it sit for 3 weeks. At that time, the pepper will have settled to the bottom, and you can easily pour off the top and discard the pepper.
Very nice extract, and as you can see, it does not belie its name. It is red, and so you can know what it is. The reason that we always label it external use only is because of the alcohol. Remember that it is rubbing alcohol, but someone may think, well, this would be good for a sore throat, but that's not good for a sore throat. It would be just like gargling with rubbing alcohol, which of course we would not want to do. Now there is another problem that we often have that we can actually treat with a red hot extract, but exercises are much better for this. And Danique Blackburn is going to help me to show the exercises that can be done for a sore shoulder. Now a sore shoulder may be sore because of a bursitis, or it may be sore because of an injury, or it may be sore because of a repetitive stress problem, but whatever the cause may be, for us to show the exercises that are done for this can be a great help. And so Danique is going to make these exercises for you using some very simple things which you can easily find in your own home. And now Danique Blackburn is going to show you some exercises that will help you to alleviate this problem. Danique?
The first exercise for a sore shoulder is called warm up with pendulums. And the way that we do this is to bend the body forward from the waist down towards the ground and hang the arm with the sore shoulder also towards the ground. We will then begin to move the arm in a circular fashion, beginning with small circles and then allowing the circles to become larger and larger. The second exercise is called across the chest, and the way that we do this is to take hold of the elbow of the arm with the sore shoulder and begin to bring it across the chest, stretching the muscles of the arm and the shoulder across the chest. Now sometimes while doing this exercise you may encounter some pain, and if you do, do not stretch the muscles across your chest so far. Do it a little bit less. But you will want to repeat this exercise 3 times and hold it for 10 seconds each time. The third exercise is called climb the wall. You will want to get near a wall in your house, put the fingertips of your hand up against the wall and begin to walk your fingers up the wall as far as you can go. When your armpit gets as close to the wall as possible, then you will want to stretch your fingers up the wall as far as you can, then hold it there for 10 seconds. This exercise you will also want to repeat 3 times. Now there's an exercise that you can do with a bath towel in your home. You will want to take the arm with the sore shoulder and grab one end of the towel. Then you will throw it over your back and grasp the other end of the towel with your other hand. Then you will begin to pull the towel up as far as you can go with your sore shoulder, and then you will pull the towel down with your other hand as far as you can go. Pull it up with your sore shoulder, and then pull it down with your shoulder that is not sore. Then you will switch arms and hands and repeat the same exercise. Pulling up, then pulling down. Pulling up, and then pulling down. Now there are three more exercises that you can do for a sore shoulder, but these ones you have to do while laying down. And so I'm going to get on the table. You will want to have 2 weights. And the first exercise is done by positioning the weight in your hand and having your arm close to your side. Then you will begin to lift the weight in this fashion several times. The next exercise is to turn on your side. Put your arm underneath your head, and with this arm, you're going to begin to lift the weights. Now, the third exercise does not require you to lay down, but you will still need the weights. You will want to place 1 weight in each hand, and you will want to hold them out like this, a little bit, with your arms a little bit below shoulder level. Then you will want to raise your arms to shoulder level and lower them again. Raise your arms to shoulder level and lower them again. You will repeat this exercise several times. And that's the end of our set of exercises for the sore shoulder.
After a few weeks, you should have a very nice functioning shoulder.
Yes.
Sometimes sore shoulders are very persistent. They may last not just for a short time, but may last for many weeks. But considering the fact that something like a bursitis can persist for a year or 2 without treatment, then of course that's not a very long time. Now, the next thing that I'd like to talk with you about is that of plantar fasciitis. Plantar fasciitis affects many people. It may be caused by inactivity or lack of exercise, and then straining the foot or over-exercising the foot, such as in climbing stairs or long walks, especially if these long walks are on a paved surface. Then the person begins to get pain on the plantar surface of the foot, or the sole of the foot. The typical plantar fasciitis begins just at the heel, just where the heel joins the arch of the foot, and the whole heel becomes very tender, especially on walking. If the person gets up at night, when they first put the feet on the floor, the plantar fasciitis is really very tender, very painful, so that walking even a few steps is quite painful. Sometimes plantar fasciitis can be so severe that the person has pain even when they're sitting down. If they take off the shoes, it may feel a bit better. And some people's plantar fasciitis involves not just the heel, but also the entire arch as well. Now, there are several things that a person can do to treat the plantar fasciitis. One thing is to use the red hot extract, which Cheryl taught us how to make, and the way to do it is simply to apply it several times a day, 4 to 6 times a day. Put it on the painful area of the heel. Now, the reason to do it 4 to 6 times a day is so that pea substance in the skin can be used up by the red pepper extract. Now, after one has done this for a few applications, maybe for 6 days at 4 to 6 times a day. Usually one can drop down to using it only twice a day. Paint it on over all of the painful surfaces just twice a day. It doesn't have to be with heat or with rubbing, just the application as it is. Now the next one is that of the stretching exercise. For this, a person needs to stand close to a wall and then brace oneself on the wall or brace oneself on a table and simply do the exercise of stretching the leg of the backward foot and make the plantar fascia get stretched, make the calf stretch, and even the hamstring muscles will stretch with this exercise. It isn't necessary to do a bouncing movement, which some people do, and in fact that can sometimes overly stretch the muscle and make an additional problem for the person. Now you do it not just with one foot but with both feet, and this can be done with both feet at one time if they're both involved by simply standing with both of your hands on the wall and leaning the chest into the wall while keeping the heels flat on the floor. And the heel is kept flat on the floor for this exercise as well. It must be kept flat on the floor. Now, a third treatment, which we have found to be very good for plantar fasciitis, is that of massage of the heel. Now, for the massage of the heel, the thumbs can usually be used for that, and a rotary movement covering all parts of the heel with as much pressure as the person who is suffering from the plantar fasciitis can tolerate. The entire heel is worked very carefully, just like this. The massage can be done not just once nor twice, but on a daily basis until the plantar fasciitis is doing much better. Now, of course, with these kinds of simple things, the little exercises for a sore shoulder, the massage and the application of the red hot extract, these are very simple things that a person can do in their own home without expensive equipment, without a great outlay of funds, and without a lot of training required in the use of much more complicated types of therapy. We enjoy working with the simple remedies so that everything can be done with the very simple things that you can find in a well-equipped home.